Hello guys, it's me again, Mohammed Lansari, regarding the vitiligo treatment. First of all, I'm sorry for the long absence. I had a hard time. I had three members of my family relatives that have passed away, and also my big brother had a tragic accident and he went to the ICU for 15 days. So I was very, stressed, and anyway, also I had also a hard time at work. Now let's talk about the current status and the understanding for the disease. As you know, guys, I'm using a combination therapy between herbal medicine and modern medicine. My hypothesis based on concentrating the beta carotene level and having more antioxidant level by topical appliement of some herbal medicine that will help, and having also a balance in copper, and without having over concentration of the copper and vitamin D. So if I'm advising you guys to have copper, using copper plates or having tablets that contains copper, you should always monitor your copper level in your blood. You should always consult your dermatologist because you don't want to have toxicity, whether it's in copper or vitamin D. I had an interesting story about one patient. I'm going to share it with you guys. It's a very challenging also vitiligo to treat, but I'm going to take this case to assist. The theories about oxidants, antioxidants imbalance are important theory to focus on. High epidermal level of reactive oxygen species have been approved by the literature, and one of the patients, she's consulting with a good dermatologist, but I was shocked that he had prescribed her some medications that are very toxic to the hepatocyte and to the liver and to the kidneys as well. And her AST levels went so far 249. It should be less than 42. ALT, alanine transferase, is 78. It should be less than 41. Creatine kinase is 10,672 units per liter, and it should be less than 167. So obviously she had, taken it for so far. Some types of drugs should be monitored, and I don't know what really happened between the medical doctor and this patient. She's 22 years old. I advise her mother to change her dermatologist. I advise her to consult Dr. Sabine. And the more challenging thing about this patient is her mother said when she exposed to sun, she get more vitiligo. She get more depigmentation. And her calcium level is low. So what's the relation now? So her medical doctor stopped the phototherapy because he observed that when she gets phototherapy, her vitiligo start to increase. Now, there is some finding in 2010. Melanocytes are attached to keratinocytes by cadherin, a protein. This protein is for cell-to-cell junction. It connects. It's like cell-to-cell junction. It's a protein that connects both layers together, keep them attached, okay? And cadherin is sensitive to reactive oxygen species if calcium is low. and this is the finding of Wanger in 2015, that if you have low calcium, the adherin will be oxidized and the melanocyte will be detached, and detachment of melanocyte will cause melanocyte loss. So I think that's how do we assist this patient, is to get back her calcium level to normal first, then assist her with the treatment by the natural ingredients that I am applying. According to this hypothesis that we placed about the beta carotene, if you see my older videos, I've concentrated the beta carotene and I do the treatment with the corticosteroids and the herbal medicine I used and mixed together. And I've tried this on myself before telling people to do it. And some people, they ask me the type, I placed the herbal medicine, but I've also getting question how to use and how to grind. And guys, this is a process that I do in home. If you want to buy this, I'm telling you the ingredients, the way how to do it. And even if you buy this stuff, sometimes you need to move or take out some of these bad seeds. You need to take only the good seeds, and among the good seeds you will blend it, and then you need to use this to take the pure powder. Then you can mix it. I've added also to the ingredients this Berries vulgaris. It's a powerful antioxidant, and you don't want this stuff. Can you imagine that these seeds how hard is this thing? This is the cassiatura seeds, one of the ingredients of the Z2. And from these flowers, as I showed you before, you'll have this type of seeds also. So it's all natural. As for me, I have stopped the Z3 and take one of my followers' advice to use the Z1, since I've added my own ingredients of more antioxidant to make this mixture more powerful antioxidants. I've changed the name so to C1, C2 and H3. H3 is the Z3, which contains solar and active ingredients. Because I'm under emotional stress, it's not a good idea to have some inflammatory action in my skin. This is what I'm having so far. And according to some theories that say that there is a genetic factor. Now, this is important. The vitiligo or vitiligo, depending on your accent, it's not totally genetic. They say that 25% to 50% is the genetic factor, and yet it's not enough to cause the disease, because there is a study that among monozygotic twins, the twins that comes from the same zygote, that the very identical twins in the genetics, only 20% of them they have both vitiligo, which means that 80% of the identical twins, you would have one which have a vitiligo and the other is not. So genetic is not enough. The environmental factor or the other factors, when it contributes, there will be a balance still, a tolerance in the body. If one of them have emotional stress or some imbalance occurred by some chemicals or anything that will break the tolerance, then it will ignite the vitiligo. So genetic is not the only thing, and even genes, it's a multigenic. It could be related to genes that changing the mitochondrial shape, it will lead to having more hydrogen peroxide, genes that having relation to antioxidant level, reducing the antioxidant level. It's a multifactorial also. You cannot treat all people in the same way. Other many types, leukotrichia, for example, some people, then they have vitiligo, they have white hair, it reaches until the hair follicle, so it depends. That's why we all should always consult a dermatologist. Now, for the orders, I'm sorry for the delay, guys. Miss Sumaya to Morocco, I'm going to send this treatment to you tomorrow. My sister and best friend Martha to Germany, I'm going to send this to you tomorrow. And Al-Jali Abdul Karim to Sudan. My brother Zakaria to Germany also. Morocco, Hajar, I'm sorry for the delay. Nisar to Australia, and I'm having a little problem with Australia and Germany. They need some extra things to add, like for example here, they need the ingredients to be typed clearly and the expiration date. And this is what I add now. One of the friends suggested to me, why don't you add C1 to the treatment? Curcumin and some Berberis vulgaris. I added also the Berberis root to the ingredients to make it more powerful antioxidant. Okay. So I'm sorry. This is did it show it? I don't know. Anyway. Okay, guys. So thank you very much for watching, and again, I'm really sorry for the delay and for the absence. I had really tough days the last month, and I hope you're all doing good with the treatments. I wish you guys all the best. Thank you for watching.